Hi everybody, my name is Sharina, editor for Strat Guys and Medical Channel Asia. Today we will be joined by Sancho Santiago, physical therapist here at Reform Athletics Philippines. So hi Sancho.
Hello.
So today we're going to talk about the SEA Games that recently happened, and some of the injuries were quite severe, but today we want to tackle specifically knee injuries. So Sam Kitatan, who contended for fencing, and Tanjin Fan for judo, are only two of those who suffered from knee injuries during the SEA Games 2023. Let's start with Tanjin Fan, who got a 3 cm surgical scar on her right knee in 2019. How can this have affected her ability to compete at 100% during the SEA Games 2023?
Let's not talk specifics because the screen have not worked with fancy that. But based on that story, the 3 cm could show that there could have been a knee surgery. So it's a scar. And with a 3 cm, because for you to know if it's ACL surgery, there could be 3 cm scar. So if it's only 3 cm, it can just be a meniscus tear. So we should know what's the difference between an ACL, the meniscus, and ACL, it's a ligament, while a meniscus is a cartilage. So a cartilage is a structure of your knee that protects from friction and from absorption. And not just knowing the anatomy, but with regards to your question, can this affect the performance of that? It's actually a yes and no. Yes, if Tanjing Fan has not been fully recovered from the injury yet, based on that, he or she did not succeed the criteria. Yes. And before you succeed the criteria, you undergo rehab, you undergo other medical practitioners like sports science, the sports psychology, because it's actually not just a physical component. Because if you get injured, you're not just dealing anymore with the physical structure, you're also dealing with the psychological structure of an athlete. So besides the injury itself, there's also this stigma. So it's a yes and no, because it really takes a leap for an athlete to overcome this difficulty or these injuries. Because to say you're 100% physically okay, you succeed this criteria, but there's this fear that's involved with that. And no, if again, it cannot affect if you did very well with the criteria themselves. So giving you a knowledge about it, there is actually a step before the athlete is cleared to play. So if Tanjing Fan is there in the sports already, that is already. And there are now a lot of criteria, or there are a lot of factors that could affect the performance of the athlete, especially in this league happened in Cambodia. There are environmental factors. So the weather, there had been addition of the Florida. So that also plays a vital role with the performance of every athlete. And another thing could have been the physical preparation and mental fat. So let's say she got injured 2 years ago, and the competition has happened this year. So that gave her 3 years of preparation. So was the preparation enough for the athlete? Was it well programmed? So there are really a lot of factors more than just looking at the knee structure. But if it happened in the same knee, then we can now see the data her performance during her practices or thing. But it's really hard to say because one, I'm not the trainer, I'm also not the official. And again, it's just not these two athletes that had injuries during the SEA Games of Cambodia. There are a lot of factors, especially so there.
So my next question is, what is the typical treatment for this kind of knee injury?
here at B-Form, it's not the one size fit all. But I do believe that every practitioner does practice this, and there's actually two typical things. One beyond the traditional model. So again, like I said a while ago, there's a criteria. So there's actually three criteria. One is the inflammatory phase. So the inflammatory phase is where you try to reduce pain, reduce the swelling. This is actually the phase where the patient or the athlete is mostly in need because he or she is not anymore capable of moving, or they are experiencing pain, there's swelling. So that's the inflammatory phase. And there's this next phase, which is the remodeling phase or the recuperation phase. So this is where, after swelling subsided, usually swelling, the inflammatory phase lasts 2 to 4 weeks, some 6 weeks, depending on the structure involved. And then once you pass the first phase, you now move to, like I said, the remodeling phase. This is where you now structure or strengthen the structure. So again, this takes 2 to 3 months, depending. And then after this phase, once you meet all the ranges, all the strength, you move to the maturation phase. This is where everything is already strong. This is where the athlete gets back to its sports. But before that, there are also some criteria that the athlete needs to meet. So it's not comparing the good leg from the other leg. So this is where he or she regains its entire strength. That's the traditional phase itself. There's this other, the traditional model itself. Now there's this other model which is called the initial pathologic model, or the KPM. This is what the physical therapists and the physical therapists usually practiced here, because here we based everything from movement. Because the difference between this model versus the typical model is that we based everything from the athlete's capability. We got based the structure from the injury. So we treat the system as a whole, because athletes, they're also built different. And for some athletes, even though they are in this inflammatory phase, they can still move. They can still do something else. So with the KPM model, we based it with the athlete's capability of think. So we start from the ECS, which is in legs, squat, or against gravity, weight gravity. So it's actually based on tailoring the assessment, or tailoring how we look the person from its potential capability. So it's not a fixed, there's no fixed stage in it, but there's a fixed phase, meaning there's where we get range, where we get strength, where we get stability. So it's based from the athlete's or the client's potential.
So now we have an understanding of the treatment of a knee injury. So I want to touch base on Sam Cantata, who got injured during the game itself and landed on silver plates. How was it even possible to still continue playing even with an injury?
It's a good question. I mean, that not aligns with the previous question or our previous topic, which is it could work with the KBM model, like I said. And going athletes, one, they could have been in their adrenaline phase. And like I said, they're built different. And a psychological factor or the psychology plays a bigger role now here. Because like you said, even though you are injured, how bad the injury is, if it's there, if it's a sprain, then take is the repeat. That's how athletes really work or play in their everyday lives. They do not show. Because athletes, they're actually good in compensating. So you would see somebody with a bad knee, but they can really squat heavy or they can run. So they can compensate and they can perform. So even though they have pain, they can sprain. And that was sort of how it's really hard to re-identify it. But really, it's the mind that really plays a bigger role here. So there are tests, there are measures to show And again, it's based on the KBM model because there's some approaches. If you do it with a traditional model, so fracture, you would see there's a swelling, but there's some swelling, there's some pain that the athlete can still compete. So it's like in boxing, if you see a lot of blood, see a lot of bruises apart, and there's this lawfare at the side, we'll just ask, can you still play? And even though you see that it's still in pain, it's already in pain visually, and he says yes, it's still there, and he's still in good. He can move, he can do some movement, he can still make a punch, make a sprint. So he'll be tested with the movement or the kinesio, meaning how the athletes move. Kinesio is meaning the movement. So before just asking verbally, the doctor or the medical person in charge, can you jump? Can you squat? Can you do a single leg squat? And if you cannot play, then you can play. So the question here, just to answer your question, if how does an athlete does it, it's now I think would say going more with the psychological component of the willingness of the athlete.
So I think, yeah, it touches base with the psychological factors and the adrenaline. It's like the mindset of just finishing the game and finishing at the top if they can, right? So now I wanted to ask, how can athletes improve their performance through physical therapy? I've seen a lot of athletes go through physical therapy with or without an injury. So how does this improve their performance?
Really, I would say, if you are in a 0%, like if you're in the inflammatory phase where you came from a severe injury, the athlete goes to the PT, goes to a physical therapy clinic. And that's where the athlete is at their lowest point of life. So physical therapy really plays a vital role in a big factor. So they play a large impact to the lives of the athlete. Because from 0, we bring them back to 100%. That's coming from an injury. So like you said, if they are injured, a physical therapy's role is to rehabilitate, we restore the movement, we restore the strength with the exercises, with some evidences, with new researches. And there are a lot of ways to bring the athlete's game back to its 100% performance. And with regards to maintaining an athlete when they're not injured, you would see a different approach, which is more based on manual therapy. You would see a lot of different strategies, different physical therapists. You will see them doing a sports massage. You will see them doing dry cupping, dry needling, cupping, wet cupping. Any approach of physical therapy can address. Like I said, it's not a one-size-fits-all. Everyone recovers differently. So the main deal here, the big impact of a physio is how does the physio change the athlete's life or add the specifics or the education. Education is key. Here we teach the athletes, so we baby them, and it's like going back because we teach them everything they need to know. Nutrition, we refer them to the specialist if they need a specialist in nutrition, sports psychology if they need one. A sports science definitely because after they're in their 100%, definitely to break more than their limits, and the sports science can do that more. So it's a bigger, so the physical therapy really plays a bigger role. The theories, really the holistic, just not biological, psychological, sociological, everything.
So now we know that recovering from an injury or rehabilitation isn't only physical, it's also very much psychological. So thank you so much, Sancho, for being with us here today. Thank you. So when it comes to rehabilitation, it always depends on the injury that they perceive. For example, it will be coming from the ankle, from the knee, from the hips, shoulder, like on the different body parts of the athlete. And also the severity, if it's traumatic or atraumatic. So like meaning you got the injury by yourself or there's like a collision with other athletes in your team. So it's not a one size fits all. So the rehabilitation for each athlete depends on the severity of their injury, the need for the team, the league they are playing onto. Because, for example, it's a pre-season league and the rehabilitation would take long. because of the their periodization of the loading phase, or it's already in season or post season. So with periodization, it depends on where the phase of the for the phase for the sport, for example, is in the loading phase, or they already need to be in plateau, or it's already in the season peak. So with that, we have to take in consideration on the rehabilitation, because for pre-season, when there's an injury for the patient, the athlete, it has to be more focused, so that when they're already in season, the injury will be lessened. So physios can recommend those kind of things, but personally, I do not believe in prevention, because we focus on reduction. There are freak accidents that we do not have, we don't have any control on preventing it, but we could reduce the severity of the injury that the athletes may receive, depending on the accident that they have. So with that, we might focus on reduction with, for example, providing them corrective exercises depending on the need of their sport. So we can also provide a different service to the clients, athletes. For example, we could provide a recovery. We could do corrective exercises depending on their needs again. And also, we could also provide overload exercises if needed. And depending again on their sports, depending on their coach's needs, if they need extra exercises on the sides aside from what they are receiving in training.